So I'd like to start off with our land acknowledgement. So Brella Community Services would like to begin by acknowledging that the land on which we gather and present from is the treaty territory of the Tsawwassen First Nations and the traditional, ancestral, and unceded territory of the Coast Salish people, specifically the Katsi, the Coquitlam, Kwantlen, Kekwat, and Semiahmoo First Nations. We respect their enduring presence, and we appreciate the land that we are able to present from. So, the project. When I spoke to you guys last week, we spoke a little bit briefly kind of on what the project I'm Still Me is about. So it's funded by the Public Health Agency of Canada. We're very excited because it is a grant that takes our knowledge nationwide. So it goes across Canada. And we've actually had a reach up to the UK, to Scotland, to India, to down in the US. So it's been pretty cool to see where our reach has hit. So we've got those 6 project outcomes. One of them is the advancement of the top priorities of the dementia strategy for Canada, heightened awareness of dementia in communities across Canada and beyond with a shift in attitudes and behaviors. We're hoping to improve quality of life for people with dementia and their care partners and also health practitioners. Development of partnerships focused on developing dementia-inclusive communities. And in these 9 sessions, we will look at what building dementia-inclusive communities looks like. There's also the social participation of people with dementia and their caregivers. So we're really hoping to assuage that stigma that comes with a dementia diagnosis, and so that people don't self-isolate themselves at home. And we're also hoping that it will be a reduction in self-stigma, which therefore results in early intervention to manage symptoms of dementia. So let's look at the why. Why do we need to understand dementia? So there's several reasons. So one of them is understanding the magnitude of its impact, which this allows for better planning and resource allocation. So dementia is a widespread condition that affects millions of individuals worldwide. So as the global population ages, the prevalence of dementia is increasing rapidly. So by understanding dementia, we can comprehend the magnitude of its impact on individuals, families, communities, and healthcare systems. And this allows us to plan and allocate resources more effectively. It also enables appropriate care. So dementia can be an incredibly challenging condition for both the individuals that are living with it and also their care partners. Understanding dementia helps equip healthcare professionals, care partners, and family members with the knowledge and skills necessary to provide appropriate care and support. So one thing we'll notice as we unpeel the onion over these 9 sessions is that dementia is individualistic as it is everybody is an individual. So while some of the symptoms and behaviors may manifest as the same, again, it depends on the person and it depends on the individuality of an individual. So therefore making that symptoms and the diagnoses to be a little bit challenging. One of the other things is to facilitate early detection. So timely intervention really greatly improves outcomes and functioning. So understanding the warning signs and the risk factors allows for early screening and diagnosis, facilitating access to appropriate treatments, interventions, and support services. So early interventions may help to slow disease progression, enhance cognitive functioning, and alleviate symptoms, thereby improving the overall quality of life with people with a dementia diagnosis. The other one is to combat stigma. So, we want to try and foster inclusive communities that respects all individuals' rights, all different walks of life, all different backgrounds. So dementia is often accompanied by stigma, misunderstanding, and social exclusion. So by understanding dementia, we can challenge misconceptions and promote empathy towards individuals that may be living with the condition. So by educating society about dementia helps to foster those inclusive communities that support and respect the rights and the dignity of people with dementia, reducing the stigma associated with the disease. I don't know if you've had a chance yet, but if you go on to Barella's website, there's a couple of pages there for the I'm Still Me project. when you get a chance, have a look, go to the resource page and just have a look at some of the videos and some of the resources that are available on there. There's one of the things, and it's the Charter of Rights for individuals with a dementia diagnosis, because it's important to understand that everybody has rights, no matter what your cognitive abilities or limitations may be. So again, by looking at the why, so, research and advancement. So understanding dementia is fundamental to driving research efforts and advancements in treatment and care. So by unraveling the complexities of dementia, research can develop new strategies for prevention, early detection, and innovative therapies. A comprehensive understanding of dementia aids in the identification of risk factors, potential biomarkers, and novel therapeutic targets, therefore leading to progress in developing effective treatments and ultimately finding a cure. So that's why I love doing something like this, because it takes the medical model and the person-centered model and it blends them together beautifully to really meet the strengths of that individual. It really also helps for societal planning. So, for healthcare systems, social services, and political policies. By understanding dementia, policymakers can make informed decisions regarding resource allocation, infrastructure development, and the creation of supportive environments for people living with a dementia diagnosis. This includes, again, designing those age-friendly communities, implementing dementia-friendly initiatives, and integrating dementia care into healthcare systems. So by fostering a society that comprehends and addresses the challenges that may be posed by dementia, we can improve the lives of those individuals that may be affected by the condition and work towards a more dementia-inclusive future. So you will hear me repeat concepts over and over and over. Like I mentioned before, research has shown that it takes 7 times of hearing something and being exposed to it for it to seat within your memory. So that's why I'm going to keep repeating things. I want you to be able to retain all of this information. Not all of it, some of it. Don't worry, it's not all of it. All right, so let's look at what is dementia. Okay, so dementia is it's not a specific disease in itself, but it's rather an umbrella term. Okay, so it's used to describe a certain group of symptoms that are associated with a decline in cognitive abilities. Okay, so it's a progressive disorder of the neurological system, which causes degeneration in thinking, recall, and communication. So structural anomalies within the brain result in the decreased capacity of cognitive functioning over time. We'll go more into this over these 9 sessions. So when you look at it as an umbrella, so it's that broad term that is for the loss of memory, other thinking abilities, and they need to be severe enough to interfere with daily life. So you're not looking for things like, oh my gosh, I've misplaced my keys, or I can't remember the last page that I read in a book, or where did I park? So, those are normative aging, losses of memory, but it's those things where it's really severe enough to interfere with daily life. So, not being able to recognize where you are, not being orientated to person, place, and time. So that's one of the assessment processes that we do when we are diagnosing a dementia diagnosis. Now, as you can see underneath this umbrella, there's all sorts of diseases that form this umbrella of dementia. And dementia isn't, while it is commonly associated with older age, it is important to recognize that dementia can occur in younger individuals as well. So we know that most people that it is strongly represented at the age of 65. But there's also cases of people in their 50s, their 40s, their 30s, their 20s, their teens, and in childhood, because there is something referred to as childhood dementia. Now that is 70 different neurological conditions that has symptoms severe enough to interfere with daily life. So it's not just an older person's disease. It's a disease that affects the brain. So, again, dementia is an umbrella term that's used to describe a set of symptoms that can include changes in, and this is not status quo for everybody. So it could be changes in memory, perception, reasoning, attention, concentration, thinking, judgment, and language. So again, it must be severe enough to interfere with a person's ability to function. And one thing that we do know is that there are modifiable risk factors that can help slow or even alleviate any instances of receiving a dementia diagnosis. But we'll go into that next week for dementia risk factors. One thing I really want to emphasize is that um, having a dementia diagnosis does not eliminate the ability to lead a fulfilling life. You can still do all of the things that you enjoyed with before you got a dementia diagnosis. You just may need to adapt them a little bit in order for you to be successful. But the person that you were and the things that you value and the things that make up who you are as an individual, dementia does not take that away. So you are still a person, hence the reason that we've named this project called I'm Still Me. So we look at things like brain changes. So one of the things that we do notice is that there is brain changes such as the buildup of abnormal proteins like beta amyloid and tau. So these play a significant role in causing dementia. So these proteins disrupt communication between brain cells and lead to cell death over time. So when you look at this infographic over here, our brain looks like a healthy head of cauliflower. So, this is a healthy brain. And you see that all of the cells and the neurons and the tissue is there. But then when you look at somebody with advanced Alzheimer's, these beta amyloids, the taus, the plaque tangles, has really started to disrupt that communication between the brain cells. And these holes that you see and this smaller area is the cell death that's happening within the brain. So there's different types of dementia. These are the main forms. So one of them that we're all familiar with is Alzheimer's disease. So this is a progressive degenerative disorder that attacks the brain's nerve cells or neurons, resulting in loss of memory, thinking, and language skills. And it can lead to changes in behavior. Vascular dementia is another. It's a decline in thinking skills caused by conditions that block or reduce blood flow to the brain, such as strokes or TBIs, so traumatic brain injuries. Another one is Lewy body dementia. So this is a progressive brain order that leads to problems with thinking, movement, behavior, and mood. This is caused by abnormal deposits of a protein called alpha-synuclein in the brain. You're starting to notice that there's some similarities here. It all involves the brain. Some of them are proteins, and it's a blockage that's leading to that dementia. There's also frontotemporal dementia. We'll go into these a little bit greater as we move along. But frontotemporal is a group of disorders that is caused by progressive nerve cell loss in the brain's frontal areas, so the area that's right behind your forehead, or in your temporal lobes. So these are the regions that are behind your ears. There's also a form of mixed dementia. So this is a combination of two or more types of dementia, such as Alzheimer's disease and vascular dementia. Those are the two common dementias that get mixed together for a mixed dementia diagnosis. Now you can see how this would be challenging to diagnose because vascular dementia and Alzheimer's disease, while they do have similar symptoms, they're also very individualistic within itself. So again, looking at the most common types of dementia in order of prevalence. So it goes Alzheimer's disease is the most common form, which accounts for 60 to 80% of all dementia cases. The second most common form, which is caused by a reduced blood flow to the brain, is vascular dementia. The third one is dementia with Lewy bodies. So this is characterized by those abnormal deposits of proteins in the brain. And then there's that frontotemporal dementia. So it's that damage to the frontal and the temporal lobes of the brain. So by understanding the prevalence and the characteristics of each type can greatly inform diagnosis and treatment. So there's some common symptoms of dementia. One of them is memory loss. So this could be difficulty in recalling recent events. So we look at when we look at memory, there's, short-term memory, there's episodic memory. So it's typically the short-term memory is the ones that you would have the most difficulty reaching. I always look at memories as like a big filing cabinet. So you got all these files in here from your whole entire life. The files still remain in place, but the ability to be able to access those files may change or may be harder to actually access. So now whether we just can't reach them or we need to take a detour in order to find that information. So that's kind of sort of how I look at the difficulties in recalling events. Another one is difficulty in concentration. So, if you're reading something and you're having a really hard time concentrating, or it's having difficulty in making decisions, especially simple ones as a yes/no decision. Now, just because you may have some of these symptoms does not mean that you have a dementia diagnosis, but it is always prudent to make note of these things just so that, because it's never too late or too early to start worrying and being concerned about your cognitive health. So language and communication problems. So difficulties following conversations or finding the right words. This also may be one of the symptoms. And this can contribute to a lot of frustration and social withdrawal from people. So it's like we call that word salad, and they are trying to get that words out, and it may not be what it is that they're trying to exemplify. And it's very frustrating for people. So yeah, it can really lead to a lot of social withdrawal. So we always want to give lots of time and respect just to let them know that, it's okay. Another one is misunderstanding what is seen. So this is problems in judging distances or perceiving the edges of objects. So a big one is when you're walking on floor and it goes from carpet until, say, a laminate. And it's that differentiation that the brain has a hard time in seeing. So it may seem that it's not a flat surface, and when an individual goes to step, it seems as though they're stepping off a big embankment. So you may notice individuals with the dementia diagnoses kind of having a little bit of spatial perception. We'll go greater into that in the next 9 weeks. Another one is confusion about time or place. I talked about being centered to person, place, and time. Some days I don't know what day it is. I don't know if it's a Wednesday or a Thursday, and that's okay. But it's really becoming confusing, and you may not know what year it is. You may think that it's like 1982 or something like that. So these are the common symptoms that you may notice. Another one is mood changes or difficulty controlling emotions. We call this emotional lability. And what it is, becoming unusually anxious, irritable, sad, frightened, or experiencing personality changes that may be out of the norm for yourself or that individual. So, I have a friend that had a stroke at a very young age, and she's got emotional lability now. So when she experiences joy, she experiences it in such a way that she's sobbing because she's just so joyful. But it's that difficulty of being able to control emotions. Or you may notice that there may be a behavior that manifests completely different in what it is that normal behavior for that individual, whether they become more aggressive or more within themselves. So these are the kind of things you want to watch for with dementia. So let's understand the difference between dementia and Alzheimer's. So as I mentioned, dementia is that group of conditions that affects the brain. And Alzheimer's is the most common form of dementia. So it's important to understand the differences between dementia and Alzheimer's in order to provide the best care for those diagnosed. So as I mentioned, dementia is that overarching syndrome. So it's that general term for that decline in cognitive ability that includes memory loss and thinking difficulties that are strong enough to impact your activities of daily living. Whereas Alzheimer's is a specific disease that affects the brain. So let's learn about Alzheimer's. It is a progressive degenerative disorder that attacks the brain's nerve cells or neurons that results in a loss of memory, thinking and language skills, and behavioral changes, and it is the most common form of dementia. So memory loss is early and significant memory impairment, especially recent events and new information. So the cognitive decline is gradual deterioration in thinking abilities, language difficulties, and impaired judgment. There may be behavioral symptoms such as anxiety, depression, and agitation, but this may occur in later stages. Disease progression, it typically progresses slowly over several years with memory and cognitive decline as the prominent features. So as mentioned, it is a progressive brain disorder. It is caused by the death of the nerve cells in the brain. There is no cure at this time. However, there are treatments that can help manage symptoms and slow the progression of the disease. These are pharmacological and non-pharmacological interventions. I'll speak about those as we go through the 9 weeks. One of the risk factors, actually 3 of the risk factors, are age, genetics, and lifestyle. So these can greatly increase your risk and likelihood of developing Alzheimer's. It's a serious condition that affects millions of people across the world. So by understanding the facts about this disease can really help us better prepare for it. So looking at these symptoms of Alzheimer's disease, so memory loss, again, it's that most common symptoms, and it's that difficulty in remembering that recently learned information. We have to go to the doctor on Monday at 3 o'clock. Okay, so what day are we going to the doctor again? We're going to the doctor at 3 o'clock. Okay. Do we have an appointment on Monday? So it's these kind of things. So it's just that difficulty in remembering that recently learned information. There's also that confusion. So, people may become confused about time, people, and places. There's that difficulty in planning, and there's that trouble understanding visual images and spatial relationships. So I like to liken it to like the Little Mermaid. She's got I think it's her doppelganger or something like that, and it's her fork that she uses as her comb. Well, it's the same thing. You may see individuals with a dementia diagnosis pick up their fork at dinner time, lunchtime, and go to brush their hair with it because they recognize the tongs on it are similar to that of a comb. So it's just that trouble understanding and trying to differentiate between those visual images. But there's so many strengths in those with Alzheimer's and any diagnosis and any individual, as a matter of fact. So by identifying the strengths of an individual with Alzheimer's disease can be a challenging task. Yet it is essential to keep in mind that they still possess many. So it's important to focus on a person's strengths and abilities and not on their limitations. Because, once you receive a diagnosis of anything, it seems to be at the front and the foremost of everything, but that does not define who you are. So if I am Kim and I have a dementia diagnosis, I'm Kim with a dementia diagnosis. I'm not Dementia Kim. I'm not Kim with that dementia controls my life. I am the person first, and I am the disease second. Vascular dementia. So this is a form of dementia that's caused by decreased blood circulation to the brain, leading to impaired cognitive abilities. So this is the second most common type of dementia following Alzheimer's disease. So symptoms of vascular dementia, again, they are somewhat similar to that of Alzheimer's disease, but it's memory loss. So it can cause difficulty with memory, thinking, and problem solving. It can create confusion and difficulty understanding language. And also it can contribute to personality changes. And you can see that as an individual, if you had a vascular dementia diagnosis, how frustrating this would be for you when you've got those memory loss that may be happening, the confusion and the personality changes. So when we look at facts about vascular dementia, so as we've learned, it is caused by reduced blood flow to the brain. It can be caused by stroke, head trauma, and other conditions that damage the blood vessels in the brain. So we've learned over the years that athletes have been having an increase of dementia, especially vascular dementia. And they've done research to find out that it's attributed to all of the knocks to the head that they take, the traumatic brain injuries that they get from either not wearing a helmet, not wearing a properly fitted helmet. I mean, I remember when I was a kid, football players maybe wore a helmet if they wanted to. So these are the people that they're starting to notice that vascular dementia has quite a strong hold on them. So when you look at the symptoms, symptoms will usually appear following one or more strokes or other vascular events that affect the blood flow to the brain. So it's all about the blood flow and the vessels that are going to the brain and the damage that they sustain. So there's a variability in cognitive abilities, and it sometimes has step-like declines after each vascular event. So you may notice that you'll be working with an individual that maybe has had some strokes, and you may start to notice that there is a noticeable step-like cognitive decline within these individuals with that diagnosis. It's not with everyone, but it is a good way to kind of monitor systems. So as it says there, it's the second most common type of dementia after Alzheimer's disease. So these stats are from the UK, but it affects about 150,000 people in the United Kingdom at this time. There's also focal neurological symptoms that actually happen with vascular too. So it depends on the location of the vascular damage within the brain. But individuals may experience specific neurological deficits. Again, these disease processes are individual to us, but it can also be a gradual decline. So even though it's a serious condition that can have a significant impact on an individual's life, it's important to be aware of the signs and symptoms and medical advice if concerned, because there's a lot of things underneath vascular dementia that are modifiable. Like wearing a helmet, getting exercise. You're going to hear me speak a lot about exercise because they always say that laughter is the best medicine, but oh my gosh, physical exercise is the one. So we look at high blood pressure, right? So we look at these conditions, and these are some of the most common conditions that are out there in individuals in the world. So high blood pressure is known to be a significant risk in developing dementia. So when you look at the percentage, so we're sitting at about 90% of the people that have a vascular dementia diagnosis have high blood pressure. That's high. That's high. So then you look at the risk factor if an individual does not have high blood pressure, and we're probably sitting at 10%. So that's like an 80% difference for something that is modifiable as high blood pressure. So we know that there's a lot of things that we can do to bring that blood pressure down. There's medications. There's also modifying lifestyle factors. So when you look at high blood pressure and its role, so hypertension, and it's being one of the most significant factors for developing dementia, especially vascular dementia. So it's that reduced blood flow to the brain. So then we look at cholesterol, right? So high cholesterol is a serious risk. It's that LDL cholesterol that can lead to the development of dementia, including Alzheimer's disease and vascular. So it's important to maintain those healthy cholesterol levels to reduce the risk of developing these conditions. So when you look at this diagram here and you see that the yellow is the buildup of cholesterol, well, when you look, if you've got high blood pressure, that blood is coursing through your system. And when you look that it's got only a little bit that it's able to get through there, we can see why it causes problems. I attribute it to like a hose. So if you get a kink in a hose, that water's still coming out, but where is it going to go? Right? So it either needs to backflow or it's going to go outwards. So therefore weakening those blood vessels and really causing those risk factors to be heightened. But we've got some positive facts about vascular dementia. So it can be treated with lifestyle changes. So these changes include eating a healthy diet, exercising regularly, and managing stress. Now, I know that's easier said than done about managing stress, especially when you've gone back to school. There's stress coming at you from every way, shape, or form, but it's just being cognizant of it and really recognizing, okay, I'm feeling stressed. I'm going to take 5 minutes and I'm going to do like a muscle relaxation or a meditation, or I'm going to go outside and I'm going to put my feet in the grass and I'm going to ground myself, or I'm going to go outside and I'm going to shake my hands and my legs, and I'm just going to have a little bit of a temper tantrum to let it all out. Whatever works for you. So really try and manage that stress. And also, if you exercise regularly, it's just an added bonus to having that managing stress built into that one. Another one is that early diagnosis and treatment can really help to slow the progression of vascular dementia. So, if you've played a lot of sports and had concussions or traumatic brain injuries or anything like that, it is never too soon to talk to your doctor about it. So we're going to talk about frontotemporal dementia. So as we mentioned, this is the one that affects the frontal and the temporal lobes of the brain. So this is characterized by changes in behavior, languages, and personality. So we've got just a diagram here. So when we look at the frontal lobe, it's a huge lobe, right? So the frontal lobe is at the front, and it's and it's over here as well, and it is involved in the decision making, problem solving, and motor control. And actually the frontal lobe also is that one that gives us that filter. So what we should say, what's appropriate, what's not appropriate, what we need to keep within ourselves. So that might be one of the symptoms that you may notice with somebody if they have frontal temporal, that they might just blurt something out that may be a little bit alarming. And then so when we look at the temporal lobe here, so this is that green lobe. It's at the side of your brain. You've got them on either side, and these are the ones that are involved in auditory processing, language, and memory. So let's look at some facts about frontotemporal dementia. So it's the type of dementia, as mentioned, that affects the frontal and the temporal lobes. Again, this is caused by the degeneration of nerve cells in these areas that leads to a decline in cognitive abilities. So there's changes in behavior, language, and personality. So, they can lead to difficulties in decision making and apathy and inappropriate social behavior, as I mentioned. So apathy is a big one. So, maybe somebody that has a dementia diagnosis that was always really wanted to go roller skating, let's just say. And then all of a sudden they're like, I don't want to do that anymore. I don't really want to do anything. They've got that apathetic mindset. So, that's something to really kind of notice, because it's really changed. It's like, hey, you love roller skating. Like, what's going on here? But you'll start to notice that just things become very apathetic and just, Frontotemporal dementia is often misdiagnosed as Alzheimer's disease or other forms of dementia, because it is challenging to really come to a really strong diagnosis and an appropriate diagnosis. But it is important to get an accurate one to ensure proper treatment. We talk about getting second, third diagnoses and referrals. I really do encourage you to do that if you notice someone is maybe getting misdiagnosed, or they're not getting the accurate diagnosis or the proper treatment. There's positives. Try to find the positives out of everything. So in frontotemporal, early diagnosis is key. So it's often diagnosed earlier than the other types of dementia, such as Alzheimer's disease. It has a slower progression. It tends to progress a little bit more slowly than the other dementias, and there are treatments available to help manage those symptoms and slow the progression of frontotemporal. There are visual hallucinations that may be involved, so they're frequent and vivid, often early on in the disease, and they're very vivid. There's a fluctuating of cognition. There could be varied levels of alertness and attention throughout the day. There could also be some Parkinsonian. So this is movement symptoms such as tremors, rigidity, and bradykinesia. So this is a slowness of movement. So you might start to notice that. So somewhat like Parkinson's, there's tremors, there's rigidity, and there is something called a drop step. So, they're not picking up their feet quite as high as they are able, or So you'll start to notice that. There's also an REM sleep behavior disorder. So this is acting out dreams during sleep and sometimes resulting in injury. I used to work with a client that he was an ex-boxer. So he had frontal temporal, but he also had vascular dementia because he had a lot of traumatic brain injury. And he was a very lucid, active sleeper. So he'd call out and he'd punch and he'd kick and there'd be times where he'd fall out of bed because he was just having such really strong, really lucid dreams that he was acting out, that he was back in the boxing ring. So we just adapted his sleeping area. We put some thicker fall mats around his bed and stuff like that to keep him safe. And the disease progression for frontal temporal actually is it progresses quite quickly. Lewy body dementia. So Lewy body is a type of progressive dementia that causes a decline in thinking, reasoning, and independent function. So it's the second most common type of progressive dementia after Alzheimer's disease. So vascular dementia is the second most common form of disease underneath the dementia umbrella, but Lewy body is the second most common type of progressive dementia. So, as mentioned, dementia with Lewy bodies is a progressive neurological disorder that's caused by the buildup of Lewy bodies within the brain. So these clumps of proteins can interact with normal functioning of nerve cells that leads to a decline in cognitive abilities. So when you look at these diagrams over here, you look at the Lewy body, which is these ones in yellow. So these are at the stages of the first and second. So most of the symptoms would be autonomic and olfactory disturbances. So then when we get into the second and third stages here, you'll start to notice that those cortical Lewy bodies are increasing, but then there's also brainstem Lewy bodies that happen. And within this brainstem is where those motor disturbances happen, and also when we get up into that frontal and that temporal lobe. So then we get into stages 5 and 6, which these are emotional and cognitive disturbances. So you can see here that we're at the later stages of the disease, and you'll see that these corticals for the Lewy body have now moved throughout all regions of the brain, and there is a greater increase of those brainstem Lewy bodies. So this is really when you start to notice those emotional and those cognitive disturbances that may be occurring with an individual. So, signs and symptoms of Lewy body cognitive impairment, which is fairly common with all dementias, and it can affect those memory, the problem solving, and the language. There's those movement difficulties, including the tremors, the stiffness, and the slow movement. There's also visual hallucinations that can be quite strong for someone. So just some research-based facts of Lewy body dementia. It's the most common cause of dementia in people under the age of 65, and that source is from the Alzheimer's Association. And Lewy body dementia is caused by abnormal protein or deposits of a protein called alpha-synuclein within the brain. Positive facts about Lewy body, because there's positive to everything. We just need to look at it. So improve sleep. We talked about having those vivid dreams and the hallucinations, but that means that these individuals are having an REM sleep, which we know is the most beneficial and the most restorative for the body. It has a slower disease progression than than Alzheimer's, and there are effective system management. So we can manage things such as sleep disturbances, hallucinations, and movement problems. These can often be treated with medications, and they can also be treated with non-pharmacological options. As I'm a rec therapist, so I really like those non-pharmacological options that we can use with individuals. Parkinson's dementia. So this is a type of dementia that's caused by the progressive degeneration of nerve cells in the brain. It's characterized by a variety of symptoms, including difficulty with movement, memory loss, and changes in behavior. So we notice that those are the commonalities between these dementias. So Parkinson's disease in itself is a neurodegenerative disorder that primarily affects movement and is caused by the loss of dopamine-producing cells within the brain. So Parkinson's dementia, typically, if it develops, will develop in the later stages, but it can occur in some earlier cases. So the exact cause of PDD, so Parkinson's disease dementia, it's not fully understood, but it's believed to be a result of the spread of the pathological changes beyond the areas of the brain that are primarily affected by Parkinson's disease. The symptoms of Parkinson's dementia can vary from person to person, but they generally include that cognitive decline, memory problems, and executive dysfunction. So these are the difficulties with the planning, the organizing, and the problem solving. They may also experience some visual hallucinations and fluctuations in their level of alertness. So it's kind of got some of the symptoms of the other diseases within itself. So diagnosing Parkinson's dementia can be very challenging because the symptoms overlap with those of other types of dementia, such as Alzheimer's disease. However, certain features can help differentiate, such as the presence of motor symptoms that are associated with Parkinson's disease, and also the timing of the cognitive decline in relation to the movement symptoms. Understanding mixed dementia. So this is a condition, as we mentioned, in which two or more types of dementia are present at the same time. So this is typically a combination of Alzheimer's disease and vascular dementia, but it can have other forms of dementia as well. It could be Alzheimer's disease and Lewy body. It could be Alzheimer's and frontal temporal, but it's typically Alzheimer's and vascular dementia. So, it has varying symptoms that may reflect a combination of the features from the different dementia types. So progression really depends on the underlying combination of pathologies that can exhibit characteristics of each contributing type. So it's important to note again that the symptoms and disease progression can vary among individuals, even if they have the same type of dementia. So additionally, individuals may experience a combination of differing types, which therefore furthers the complication of clinical presentation. So proper diagnosis by a healthcare professional is essential for that accurate identification and management of specific types. Let's look at childhood dementia. So I brought it up that childhood dementia is caused by over 70 neurological disorders. So childhood dementia refers to a dementia that begins under the age of 18. It's caused by those various neurological disorders that affect the brain. So some of these common causes include Batten disease, Niemann-Pick disease type C, neuronal ceroid lipofuscinosis, and some types of leukodystrophies. But yeah, so these 70 different neurological disorders can be rare, but they have noticed that there is an increase in understanding childhood dementia. And actually, the UK has an initiative that's based mainly on childhood dementia. So symptoms may vary, but they, again, often include that decline in thinking skills and memory. The common symptoms are similar to that of adult dementia with, that memory loss, the problems in reasoning, visual perception issues, but there's also seizures that are thrown in there as well. Again, positive facts of childhood dementia. We try and find the positives in anything. So childhood dementia has a slower progression than adult dementia. So symptoms tend to develop gradually over years rather than months. Some cases are irreversible. So treating underlying conditions like vitamin deficiencies can help reverse symptoms in some cases. And this actually lends true for adult dementia as well. Early diagnosis is important. And I mean, you wouldn't think that as a child you'd need to look at childhood dementia, but by starting treatment and supporting the diagnoses early can really greatly improve quality of life. So it is a challenging diagnosis, but there is definitely positive aspects when it's recognized early and managed appropriately. So there's also a young onset dementia. So this is the type of cognitive impairment that affects people that are under the age of 65. Although it is less common than late onset dementia, it does have a significant impact on individuals, their families, and their careers. So conditions such as Alzheimer's disease, frontal temporal dementia, and certain genetic disorders can lead to the early onset rise. So when we look at it, we talk about Alzheimer's disease being the most common disease that falls underneath the dementia umbrella. And by the age of 60 plus, this is usually the age of onset that we start to notice Alzheimer's disease. But again, it's not all inclusive for being 60 and plus. So another one is frontal temporal dementia that we spoke about. And typically the age of onset for that is 50 to 60 years old. Then there's Lewy body and vascular dementia, and the age of onset for those is between the age of 50 and 70 years old. So these are just some statistics from the Alzheimer's Society that are important to kind of make note of, because, age is not the only factor to getting an Alzheimer's diagnosis. So in some cases, that early onset can be caused by specific genetic mutations that predispose individuals to develop the condition at a younger age. So, for example, familial Alzheimer's disease can be caused by certain gene mutations that have been inherited from parents. So there's also other genetic diseases such as Huntington's disease and certain forms of frontal temporal that can result in dementia in younger individuals. So memory loss in young onset dementia is not actually the first symptom. So this young onset is more likely to cause problems with movement, walking, coordination, or balance. While it does exhibit the same symptoms as other dementias do, memory loss typically isn't that first symptom. So again, it's those problems. So like, are you doing yoga and you find that you haven't got the balance that you used to? So, and then as mentioned, it can be inherited. It can be passed on through genes. So, some positive facts about early onset dementia. So the slow progression allows individuals time to adapt. So, being able to adapt to those changes and coming up with a nice care plan and what your future is going to look like, that's one of the positives of getting an early onset diagnosis. And also another one is close relationships are built. So it gives time for caregivers and care partners to develop those close relationships with that person as they care for them over time. And again, so, there's that more time to plan and care. So since that progression is slow, it gives you more time to research those options and make the best care plans possible that you can. So there's 3 stages of dementia, and, it's the early stage, and it's the difficulty in remembering those recent events, names, and it kind of gives you that apathy. There's the middle stage, which is, increasing memory loss, confusion, and maybe some increasing difficulty with daily tasks. So a perfect example is peeling carrots. The knowing on how to use the peeler and to rotate the carrot as you take that peel off. So you might start to notice that, someone may be peeling and they'll just keep peeling in the same area, and they've lost that insight to know to turn that carrot to take that skin off. So it's an example of a difficulty of a daily task. And then when you get into the late stages, there's that severe memory loss, the inability to communicate, and there's a complete dependence on caregivers. Now, I like to say that, having dementia inclusive communities, I really am all for aging in place, because that's the most wonderful thing that you can do. But, when you get into these late stages, that's where residential care and long-term care really comes into as a great benefit, because it really provides that support, not only for the individual that may be in the late stages of dementia, but also gives them that caregiver. Because even though caregivers and care partners, they do so much research and they've got so much knowledge and strengths behind them, not everybody is a care partner, and not everybody has that strength and that knowledge. So it can be really impactful on people and really, really take a toll. So there's something called the 7 A's of dementia, and these are the neurological dysfunctions. So one of them that I mentioned was apathy, right? So that was that lack of interest or emotion towards something that, that individual may have had strong passion towards. Another one is anosognosia. So this is a condition in which a person is unaware of their own disability or illness. So I work in a day program, and I work with individuals that might not be aware that they have a dementia diagnosis. And, I'll hear them speak about someone else in the day program and be like, oh, that man over there, I feel bad for him. He has dementia. Have you heard of dementia before? And I'm like, yes, actually I have. And I was like, but you shouldn't feel bad for him. He's here having fun. And then, like maybe 2 minutes later, he'll be like, oh, that man over there has dementia. Have you heard of dementia before? So it's that inability to recognize your own disability or illness. And it's not necessarily a bad thing. There's also amnesia. So this is a condition in where a person has difficulty remembering past events. So, likening back to that filing cabinet where all those files are there, but I think I've got something back there, but I'm not really too sure. I mean, I can't remember everything that's happened in my lifetime as well. So aphasia is another one. So this is a condition in where a person has difficulty understanding or using language. I was fortunate when I was getting my degree that I got to go to an aphasia camp, and everybody got paired up with an individual with aphasia, and it was really cool because it manifested completely differently with different people. So it's that knowing that you want to say it's beautiful and sunny with a blue sky out today, but you just can't get the words out, and that can be very frustrating for people. The other one is agnosia. So this is where a person has difficulty recognizing objects, peoples, or sounds. So going back to that little mermaid using her fork to comb her hair. So it's that inability to recognize those objects, but you've seen them before, so they're familiar to you, but you just can't quite put your finger on it. Another one is apraxia. So this is a condition in which a person has difficulty performing motor activities despite having the physical ability to do so. So this may be something as doing a two-step or just doing a step touch if you're doing an exercise class, or even like a step touch with your heel out in front of you. So even though they have the physical ability to do it, they may have that difficulty because their motor functions isn't allowing them to do so. So the last one is altered perception. So this is a condition in which a person's perception of reality is disoriented. And we talk about this in therapeutic recreation all the time because we call it therapeutic listening and therapeutic lying, and also validation therapy, because a person's perception and where they're at is very real to them. It may not be real in our world, but in their world, it is their reality, and it is what they're seeing, and it is what they're experiencing. So I will jump into that person's reality. I've had it once where one of our clients was a little girl. She was playing on a playground, and there was a playground bully that wasn't being very nice to her. So I stepped right into that journey. I was her little girl's friend on the playground, and we navigated that together. And, and that reality may be distorted. It was a little bit of a bone in contention in my degree program because people are like, we don't want to lie to people, but we're not lying. We're stepping into their truth, because even though we know that it's not true, it is very, very real to them. And, you want to be validated. You don't need to have someone come up to you, go, oh, come over here. You're just imagining things, because that's really impactful. So, yeah. So there are some increases to your risk in developing dementia. One of them is high blood pressure, right? So we talked about how they can damage the arteries and really increase your risk of dementia. Another one is physical inactivity. So lack of physical inactivity can lead to an increased risk of dementia. Also, drinking too much alcohol. There is something that is alcohol-induced dementia. So excessive alcohol consumption can damage the brain and increase the risk of dementia. We'll go over that more next week because it's dementia risk factors is the topic. Smoking is another one, as it reduces the amount of oxygen that reaches your brain. Hearing loss. So this is one, it can lead to socialization, which is a risk factor for dementia, but also it really leads to stigma. People, if they can't hear, they don't really want to go out anymore because they're like, oh, no one hears me anyways. So we want to try and modify all of these modifiable risk factors to make someone successful so that they will still continue to participate in society. And a poor diet is another one that can really greatly reduce your risk of developing dementia. So it's like everything that we've always heard, lower your blood pressure, get lots of exercise, drink in moderation, don't smoke, and watch your diet. So when we look at the reduction of, what does it look like in midlife? So if you exercise regularly, it can reduce your risk by up to 40%. 40%! heck yeah, I'm going out there and I'm going to exercise. Eating a healthy diet. Now, that doesn't mean that if you want to have a little bit of a treat or a cookie or something like that, everything in moderation. But if you eat a healthy diet, such as the DASH diet or the Mediterranean diet, which research has showed is so beneficial for all walks of life, but by eating a healthy diet can reduce your risk by up to 35%. Oh my gosh. So then you throw social activity in there. That reduces your dementia risk by up to 30%. And then challenging your brain. That also gives you a reduction of the risk of getting a dementia diagnosis by up to 25%. Now that's doing something, doing a puzzle, doing a Sudoku, playing a new instrument, learning a new language, doing a crossword puzzle, doing a word search, doing video games, anything that challenges your brain, and just like exercising regularly, anything that gets your heart rate up and, gets that good cardiovascular exercise. Look at the benefits and the percentage and how great that is. So you can go out there and you can preach to the world to eat regularly, eat a healthy diet, stay active, and challenge your brain. There are some common misconceptions. So dementia is a natural part of aging, and that couldn't be any farther from the truth. So while dementia, the risk factors do increase at the age of 65 and above, of which we'll learn more about next week, it is not a guarantee that just because we get older that we're going to get dementia. Another misconception is that dementia is not treatable. So while there is no actual cure, there's so many treatments and therapies that can really help manage the symptoms. One benefit to the pandemic is that all of the resources that are available and the capacity to do things such as this, webinars. And the last one is people with dementia are unable to live independently. I totally disagree with this one because with the right support, many people with a dementia diagnosis can continue to live independently for many, 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 many years. We talked about diabetes as a risk factor for developing dementia, and I just wanted to go back to this because it is a very high risk factor because those high blood sugar levels can damage those blood vessels of the brain. And one thing that we're trying to do is to maintain that integrity of the blood vessels. We want to maintain that elasticity that they have and the ability to move and flow and pump and have nothing obstructing the blood flow because you really want to get that blood going up to the brain so that you don't have that impaired cognitive impairment. And, when you look again, I'm going back to that vascular dementia, but there's so many things within that vascular dementia diagnoses that you can mitigate, that those are those modifiable risk factors that you can work on and increase. So again, dementia risk factors, age, it does increase from the age of 65 up. I'll go into the greater statistics of that next week. Genetics, there's a familial history of dementia, and it could increase the risk, but it doesn't mean that you are going to get a dementia diagnosis. And the number one thing is lifestyle, because an unhealthy lifestyle can definitely increase your risk, and these are the things that you can change, and it's fantastic. So we look at current prevalence rates of dementia, and, we did say that it does increase with age. So, your increase does it gradually increases. So between the ages of 60 and 74, we look at the prevalence rate and we're sitting at about 8%. But then we look at the ages from 75 to 84 and we've about doubled. So we know that the prevalence starts to double every 10 years after the age of 65. And then you look at the age of 85 and plus, and we're sitting at about a prevalence rate of about 38%. So even though it does increase with age, there's only 38 of the population over the age of 85 that actually has a dementia diagnosis. So just a little a graphic here on the global impact of dementia. So, there's a new diagnosed case every 3 seconds. By the year of 2050, which really isn't that far away, we're looking at 131.5 million people with a dementia diagnosis. So much of this increase does take place in low and middle income countries. We'll talk about that in week 4. It's under the topic of cognitive reserve and what that looks like. and why it's so beneficial to us. So there are some strategies for improving your cognitive function and your well-being. So you really want to work on your brain health. So encourage those healthy eating habits, that physical activity, and that mental stimulation. Those are the three things we can control. Social engagement. So, maintain that meaningful social interaction with family and friends. And I've mentioned not everybody's an extrovert, and that's okay. Do whatever social engagement means to you. I mean, it could be with cats and dogs if you like, whatever works for you. You want to do that, whatever sets you up to be successful. You also want to do stimulating activities that are engaging and purposeful and enjoyable. So, we talked about the importance of early diagnosis because it can lead to better treatment options. It can help individuals access support services much easier and earlier, such as counseling, respite care, and home care. And early detection really helps individuals to plan for the future. So, there's decisions that need to be made about finances, living arrangements, and other important matters. We will talk about that one in week 8. So that topic is called a dementia diagnosis. Now what? And we're going to look at what it means to have a diagnosis as a person living with dementia, as a care partner, supporting an individual with dementia, and us as community members, advocates, and healthcare practitioners. What does that look like, and how do we support individuals living with a dementia diagnosis? So when we look at uncovering the causes of cognitive impairment, I keep mentioning that you really want to have a strong diagnosis of dementia, because that thorough assessment is essential to ensure that any cognitive impairment is not caused by other conditions, because there are other conditions that can cause cognitive impairment. It does not automatically mean that you have a dementia diagnosis. So it is important to identify and address any underlying causes of dementia-like symptoms accurately. And I encourage you to start, even now, just start documenting things. Just, how are you feeling? Do you have any cognitive decline? Do you have any brain fog? Are you feeling tired? Just to really kind of make a note. And it's also important to note as you go through your education of your 4 years, you're going to find things that you're going to get stressed, you're going to get tired, and you're going to start to forget things. And then you might go, oh my gosh, I have dementia. That's not the case at all. So you really want to make sure that you get a really strong assessment process and diagnosis and care plan so that you can live the best that you possibly can. So as mentioned, we're almost there, you guys. There are treatment options for individuals living with dementia, such as medication. And, prescription drugs can really help to manage those symptoms, such as memory loss, confusion, and any behavioral changes. There's also therapy. So like cognitive and behavioral therapies can help individuals with a diagnosis to cope with their condition, also can help care partners. There's also recreation therapy, occupational therapy, physiotherapy. There's all different allied health that can also complement those different medications and therapies. And again, making those lifestyle changes such as eating a healthy diet, exercising regularly, and getting enough sleep. Sleep is really important because that really helps improve not only your quality of life, but your cognitive functioning. So just to touch on a little bit, if you get a dementia diagnosis, what do you want to do? You want to understand your diagnosis, you want to seek support, and you want to plan for your future. It can be incredibly overwhelming, but there are practical steps that you can take to help plan for your future. And there's a lot of people and resources out there that can support you along in this journey. So again, what dementia is not, it is not a normal part of aging. It is not a single disease. It's that umbrella term for a range of conditions that may affect the brain, and it's not always progressive. So some forms of dementia may be just stable over time, while others have that incremental steps and may worsen over time. Again, it's complex and it affects many people, but it's better to understand what it's not in order to understand what it is in order to help those that may be diagnosed with it. So there's a few things that we can do for respectful interaction. The one thing that I always get is when I take students or whatever, they're like, oh, what do I say? What do I talk about? Talk about just what you would with any other normal person. Understand that person's needs. Do they have aphasia? Do they have movement issues? Do they maybe have a little bit of confusion for person, place, or time? So, just really getting to understand that person and just really be patient. Allow that extra time for tasks and conversations. And, be patient with any confusion or frustration that that individual may be experiencing. It can be challenging to live with, and always be positive. So you really want to always encourage that person to stay active and engaged and really focus on their strengths and their abilities as opposed to their limitations. And then you can also provide support. So this is emotional support, reassurance, and to help them stay connected with friends and family. One of the most impactful things that we've noticed is a lot of people want to self-isolate. They don't want to burden others. And there's that stigma that we're talking about that we really want to assuage and eliminate. So just kind of looking at the impact on communities. So care partners, it can be really, really impactful for those supporting individuals with a dementia diagnosis because there's a lot of physical, emotional, and financial strain that comes from it. Family members as well may experience feelings of guilt, grief, and loss. We hear quite often that when people are in the last stages of their dementia diagnoses, that family members and care partners feel that they have lost them twice because they're going through the dying process, and the brain may already be at a stage where there's not a lot of neural pathways left. So they're grieving losing that person twice. So once in body and once in mind. And society, dementia can have a really significant economic impact on society due to the cost of care. So just some tips for caregivers. You want to educate yourself, talk to a doctor, connect with multiple support groups. There's all different varying ones out there. There's in-person, there's work through support groups, there's sit and listen, there's talk therapy, there's webinars. You can do it virtually, you can go in person. And then you also want to develop a plan. So this is not only for the individual, supporting the individual and managing the symptoms of dementia, but you also want to create a good care plan for yourself. Because like we say on planes that, the first thing you need to do is put on your own oxygen mask before you can assist others. So it's the same kind of deal. And this caregivers and care partners, that also involves us. It involves healthcare practitioners, because we get really attached to these individuals because we have that passion, and it's really good to have a good plan, not only to protect yourself but also others. So again, study the dementia, learn the stages, learn different communication techniques, and then there's some self-care, and this also means for yourself. So take some time for yourself. Just really schedule those regularly scheduled breaks. Stay connected, maintain the relationships with your friends and family. Keep doing your exercise. And, this will really, not only is this self-care techniques for caregivers, care partners, but this will also really help you get through your guys' degree program. And, how do you create that time for self-care, especially when you're so busy and you've got so many things coming at you and so many obligations and commitments? Set a schedule. So, create a schedule that allows time for self-care and stick to it. And self-care looks different to different people. Now, that may be going for a walk. It may be doing a facial mask. It may be doing some yoga. It may be reading poetry. But, set that schedule and really stick to it. So if you've scheduled half an hour that you're going to do something for yourself, stick to it. And you really want to prioritize those self-care activities, right? So by sticking to it, you're making them a priority. And if you need help, don't hesitate to ask family and friends for help, not only with caregiving duties, but also to kind of help you through your education. So things that you can do with a dementia diagnosis, talking to your doctor. We'll go into this greater into week 8. Things that you need to be heard as a care partner. You really want to understand that diagnosis, be organized, and be an advocate, because, as we know, we need to advocate continuously for not only ourselves, but for those that we care for. Just tips for the general public, just educate yourself like you guys are doing. Just be patient and listen. The biggest thing that we can do with working with an individual with dementia is to try and understand their perspective. We have a tendency to not like empty, dead space, so we kind of try and fill the space, but it's okay to ask a question and then just kind of step back and wait for that individual to give you their perspective. Business tips, educate staff, create a safe environment, be patient and understanding. So these are things that we can do as ourselves. So we can create support groups, we can encourage social activities, and provide education. And so action So how do we create dementia inclusion within the communities, right? So we really want to understand dementia, so learn about the different types of dementia, how it affects individuals. And now that you guys have a little snippet of it, you can go out there and share your knowledge forward. The other thing you want to do is try and create a supportive environment. So something that's safe and welcoming for those with a dementia diagnosis, and you really want to include them. I'm really big on inclusiveness and including all individuals of all walks of life because like ER says in Winnie the Pooh, I may not always feel like doing something, but please always include me. So please always try and include everybody. And then provide resources. Make resources available for those with a dementia diagnosis, their care partners, your coworkers, your colleagues, uh, your cohort within your program. So yeah, there's lots of different things that we can do. Here are the resources that I used to create this presentation. If you would like any of these resources sent to you, let me know. I'm going to stop sharing my screen now. We're done. Good job, you guys. You made it through. Thanks for joining me. Bye.